Hey there! Do you ever find yourself reaching for a glass of water the moment you try to eat a simple cracker? Or maybe your tongue feels like sandpaper, sticking to the roof of your mouth, making it hard to talk clearly sometimes? You might even think, oh, well, that's just part of getting older, isn't it? Millions of people our age experience this every single day, often dismissing it as a minor annoyance. But what if this common feeling, this persistent dry mouth, could actually be quietly affecting your health and your comfort more than you realize? It's not just about feeling thirsty. It can impact your ability to enjoy food, chat with your family, and even protect your teeth. You might be surprised to learn that what feels like a normal sign of aging could actually be a condition with identifiable causes and, more importantly, simple solutions. We're talking about something called xerostomia, or quite simply, dry mouth. It sounds straightforward, right? Just dry mouth. But understanding why it happens and what you can do about it is key. It's often linked to things that feel complex, but the steps you can take are usually quite simple and accessible, fitting easily into your daily routine. This isn't just about discomfort. Chronic dry mouth can slowly take away little pieces of your independence, making eating out awkward, limiting how long you feel comfortable talking on the phone, and silently increasing your risk of dental problems that can cause pain and require costly treatments down the road. It can lead to difficulty swallowing, which is worrying, and even affect your nutrition if certain foods become too hard to eat. You might think it's just something you have to live with as you get older, but the truth is, it's often manageable, and you don't have to suffer in silence. In this video, I'm going to walk you through the common reasons behind the persistent dry feeling, the potential consequences you absolutely need to be aware of, and most importantly, share 7 simple, practical things you can start doing today to find relief and protect your health. These are easy to follow tips that can make a real difference in your daily comfort and overall well-being. But before we dive into the specifics, if you're curious about understanding and managing dry mouth, please hit that like button right now. It really helps this information reach more people who could benefit. And while you're at it, make sure you're subscribed to the channel and have the notification bell turned on so you don't miss our future health tips designed just for you. Let me know by typing dry in the comments below if you're ready to learn more with me. All right, let's get started. The first thing we need to understand is what causes dry mouth in the first place. Point 1. Your medicine cabinet. This is perhaps the most common culprit, especially as we get older. Many medications that are essential for managing conditions like high blood pressure, allergies, depression, anxiety, pain, and even common cold remedies can have dry mouth as a side effect. They work by affecting certain signals in your body, and sometimes that includes the signals that tell your salivary glands to produce saliva. It's like they turn the saliva faucet down or even off. I saw this firsthand with my neighbor, Robert. Robert is in his late 70s and takes a few different pills each day for his heart and blood pressure. He started complaining that his mouth felt constantly parched. He'd wake up several times a night just for a drink of water. He told me swallowing his morning pills felt like trying to swallow sand. He thought it was just because he was getting old. But after he mentioned it to his doctor, they reviewed his medications. It turned out one of the newer ones he started was a major contributor. His doctor was able to adjust the timing slightly and suggest some simple remedies. And while it didn't disappear completely, the relief was significant. He could swallow comfortably again and wasn't waking up thirsty every hour. Robert's story really highlights how important it is to consider your medications. This constant dryness from medication doesn't just make you uncomfortable, it can make it harder to stick to taking those vital medications, and it sets the stage for other problems we'll discuss. So the practical takeaway here is this. If your dry mouth started or worsened after beginning a new medication, please talk to your doctor about it. Don't stop taking your medication, but ask if there might be alternatives, dosage adjustments, or strategies to manage the side effect. Medications are a big one, but they aren't the only cause. Let's look at another factor that often plays a role. Point 2. Not getting enough fluids or certain habits. Sometimes dry mouth is as simple as not being properly hydrated. As we age, our sense of thirst can decrease, meaning we don't feel the urge to drink as often as we should, even when our body needs it. Other lifestyle choices also play a big part. Smoking and using tobacco products severely dries out your mouth and irritates the tissues. Regularly drinking alcohol or caffeinated beverages can also contribute to dehydration and worsen dryness. My friend Eleanor loves her morning coffee, and for years, she'd have 2 or 3 large cups before having any water. She also enjoyed a glass of wine most evenings. She developed really bothersome dry mouth, cracked lips, a sore throat. She tried chewing gum constantly, but it only helped a little. When her dentist pointed out how dry her mouth looked and asked about her fluid intake, Eleanor started paying attention. She made a conscious effort to drink a glass of water right after her first cup of coffee and limited her evening wine to special occasions. Just those simple changes, increasing her water intake and cutting back on alcohol, made a noticeable difference in how her mouth felt by the end of the day. It wasn't a magic cure, but it significantly reduced her discomfort. Ignoring dehydration or continuing with habits like smoking makes it incredibly hard for your mouth to stay moist and healthy. Make it a goal to sip water consistently throughout the day, not just when you feel extremely thirsty. Try carrying a reusable water bottle with you. If you smoke, seeking help to quit is one of the best things you can do for your overall health, including your mouth. And try to moderate your intake of coffee, tea, and alcohol. Are any of these causes sounding familiar? Let me know in the comments which one resonates most with you. Now, understanding the causes is important, but why should you really care about dry mouth? What are the potential consequences if it's left unmanaged? Point 3. The dental damage. Saliva does so much more than just make your mouth feel wet. It's your mouth's natural defense system. Saliva washes away food particles and bacteria, neutralizes acids produced by plaque, and contains minerals that help protect your tooth enamel. Without enough saliva, these protective functions are drastically reduced. This means bacteria and acids have a field day, and your risk of developing cavities, especially around the gum line, and gum disease skyrockets. Dry mouth can also make you more prone to oral infections like thrush, which is a fungal infection that causes white patches and soreness. I remember meeting a gentleman named Arthur at a community center. He had always had pretty good teeth, maybe just a cavity or two over the years. But in his late 60s, his mouth started feeling increasingly dry, likely due to a combination of age and medications. He didn't think much of it beyond the discomfort. At his next dental checkup, the dentist found 5 new cavities. Arthur was shocked and upset. The dentist explained that the lack of saliva had left his teeth unprotected. It took several appointments and significant expense to get his dental health back on track. Arthur learned the hard way that dry mouth isn't just a feeling, it's a serious risk factor for dental decay. Allowing chronic dry mouth to go unaddressed can lead to significant pain, tooth loss, and complicated, expensive dental work that could have been avoided. It's a hidden threat to your smile and your ability to eat comfortably. Maintaining excellent oral hygiene is even more critical when you have dry mouth. Brush twice a day with fluoride toothpaste and floss daily. Talk to your dentist. They can recommend specific fluoride rinses or varnishes that provide extra protection. Regular dental checkups are non-negotiable. Beyond dental health, dry mouth can make everyday activities surprisingly difficult. Point 4. Making simple things hard. Think about how saliva helps you chew and swallow food. It moistens the food, binds it together, and helps it slide down your throat easily. When your mouth is dry, eating can become a chore. Food gets stuck, it's hard to chew properly, and swallowing can feel difficult or even like food is getting caught. Similarly, saliva acts as a lubricant for your mouth tissues, tongue, and lips. Without it, your tongue can stick, making it hard to form words clearly. Your lips might feel dry and cracked, adding to the discomfort. My Aunt Martha is a very social person. She loves chatting with her friends and enjoys family meals. A few years ago, her dry mouth became so severe she started avoiding group lunches. Eating was just too uncomfortable, she'd cough and choke on food, and the taste wasn't the same. Talking for more than a few minutes would leave her mouth feeling painfully dry and sticky, making her self-conscious. She felt like she was losing a part of herself. With some simple management techniques her doctor and dentist suggested, including using artificial saliva products and specific strategies while eating, Martha started feeling more confident. She gradually rejoined her friends for lunch and felt comfortable participating in conversations again. It showed me just how much dry mouth can impact quality of life and social connection. Losing the joy of eating or feeling hesitant to talk can significantly impact your social life and mental well-being. It's not just a physical issue, it has emotional and social dimensions too. When eating, take small bites, chew thoroughly, and sip water frequently with your meal. Avoid dry, crumbly foods like crackers or tough meats. For talking, keep water handy and take sips as needed. There are also products available to help keep your mouth moist, especially before social situations. Have you experienced any of these difficulties? Share your experience in the comments below. Your story might help someone else feel less alone. Okay, so we've looked at what causes dry mouth and the problems it can create. Now for the good news. What can you actually do about it? Point 5. Simple sips and chews. The most straightforward way to combat dryness is to directly introduce moisture and encourage your mouth to produce its own. Sipping plain water frequently throughout the day is your first line of defense. Don't wait until you're parched. Little sips often are more effective than gulping a lot at once. Another simple trick is to stimulate saliva flow by chewing or sucking. Sugar-free gum or sugar-free hard candies are great for this. The action of chewing or the taste stimulus helps kick your salivary glands into gear. Make sure they are sugar-free to protect your teeth. Think about my friend Robert again, who had trouble swallowing pills. While adjusting his medication timing helped, his doctor also recommended he keep a water bottle with him constantly and take sips even when he didn't feel thirsty. He also started chewing sugar-free gum after meals. He said the combination of consistent sipping and chewing the gum made a noticeable difference in his overall comfort level within just a couple of weeks. It wasn't complicated, but it required consistent effort. He keeps a special water bottle by his favorite chair now as a constant reminder. These small, consistent actions of staying hydrated and stimulating saliva can provide significant relief and make a big difference in your daily comfort without requiring major changes. Carry a water bottle. Set reminders on your phone if you need to. Keep sugar-free gum or candy in your pocket or purse. Make these simple habits part of your routine. What if those simple steps aren't enough? Thankfully, there are other options available. Point 6. Using artificial helpers. For more persistent or severe dry mouth, there are over-the-counter products designed to mimic natural saliva. These include artificial saliva sprays, rinses, gels, and even lozenges. These products contain lubricants and sometimes minerals that help moisten and protect your mouth tissues. They provide temporary relief, acting like a moisturizer for your mouth. Some are designed for daytime use, while thicker gels can be helpful at night to provide longer-lasting moisture while you sleep. Remember my Aunt Martha, who had trouble with eating and talking. While staying hydrated helped, she found that using a specific artificial saliva spray about 15 to 20 minutes before meals and social gatherings made a world of difference. It gave her mouth the lubrication it needed to chew and swallow more easily and to speak without her tongue sticking. She also used a thicker gel product at night, which helped her sleep more comfortably without waking up with a dry, sticky mouth. These products, recommended by her dentist and pharmacist, didn't cure the underlying cause, but they provided essential relief that allowed her to reclaim some of her social life and comfort. These artificial saliva products can be invaluable tools for managing symptoms and preventing complications when basic hydration isn't enough. They offer targeted relief where you need it most. Visit your local pharmacy and ask about artificial saliva products. Try a few different types spray, gel, rinse to see what works best for you. Follow the package instructions and don't hesitate to ask the pharmacist or your dentist for recommendations tailored to your specific needs. Finally, while these home remedies and over-the-counter options are great, there's one crucial step you should never skip. Point 7. Talk to your doctor and dentist. This is perhaps the most important tip. Dry mouth can be a symptom of an underlying medical condition like diabetes or Sjogren's syndrome or a side effect of medication, as we discussed. Only your doctor can properly diagnose or adjust your medication safely. Your dentist is your expert on oral health and can assess the effects of dry mouth on your teeth and gums, recommend specific fluoride treatments, and suggest appropriate saliva substitutes or other products. They work as a team to help you. Consider the story of Mr. Henderson. He had severe dry mouth for years, but he just assumed it was normal aging. He didn't mention it to anyone. He ended up with significant dental problems and persistent discomfort. When he finally brought it up to his doctor during a routine visit, they ran some simple tests. It turned out his dry mouth was a key symptom of an undiagnosed underlying condition that could be treated. Addressing that condition, combined with the dental care his dentist provided, made a world of difference. He regretted not talking to his doctor sooner, realizing he had endured years of unnecessary discomfort and health risks. His experience is a powerful reminder that professionals are there to help identify the root cause and provide targeted solutions. Trying to manage dry mouth solely on your own without professional input means you might be missing an underlying issue or the most effective strategies for your specific situation. Don't guess when you can get expert advice. Next time you visit your doctor or dentist, mention your dry mouth. Describe when it started, what makes it better or worse, and list all the medications and supplements you take. Be open about how it affects your daily life. Their guidance is invaluable. Beyond those key strategies, here are a few more practical tips. Avoid sugary drinks and acidic foods, as these can damage teeth already vulnerable from lack of saliva. Try using a humidifier in your bedroom at night to keep the air moist. Be cautious with mouthwashes that contain alcohol, as they can be drying. Look for alcohol-free options specifically designed for dry mouth. Also, avoid scraping your tongue too hard, as this can cause irritation. One common mistake people make is thinking any liquid will help. While water is best, sugary drinks or acidic juices can actually harm your teeth when you have dry mouth. Another error is stopping medications without consulting a doctor. Never do this. Your doctor needs to know about the side effect and guide you on safe alternatives if necessary. And please, don't just ignore it, hoping it will go away. As we've seen, it can lead to bigger problems. Remember, your dentist and doctor are your best resources for personalized advice and ruling out any underlying health conditions. So we've covered the common causes, the important consequences for your dental health and quality of life, and several simple, actionable steps you can take right away, from sipping water and chewing sugar-free gum to using special products, and crucially, talking to your healthcare providers. These aren't complicated solutions, but they require consistent effort and awareness. I know it might feel like just another one of those things that happen as you get older, and it can be easy to just live with the discomfort. But ignoring chronic dry mouth isn't just about enduring stickiness. It can subtly steal your comfort, your enjoyment of food, your confidence in talking, and significantly increase your risk of painful and expensive dental problems. You don't deserve to live with that unnecessary discomfort and risk. Here's the empowering truth. You have the power to make a difference in how you feel. Age is just a number, but choosing to address even seemingly small health issues like dry mouth can dramatically improve your comfort and well-being in your golden years. It's never too late to start taking better care of yourself and advocating for your health. You have the right to choose comfort, health, and the freedom to enjoy meals and conversations without that constant feeling of dryness. As you've seen, dry mouth, or xerostomia, is more than just a minor annoyance. It has real causes and potentially significant consequences for your health and quality of life. But the good news is, it's often manageable with simple strategies and the right professional guidance. Taking action against dry mouth isn't just about having a wetter mouth. It's about protecting your teeth, enjoying your meals, speaking comfortably, and maintaining your independence and overall well-being. Now that you have this information, what was the most surprising thing you learned about dry mouth? And what's one simple step you're going to try starting today? Share your thoughts and plans in the comments below. I'd love to hear from you. If you found this video helpful, please give it a thumbs up to show your support. And if you haven't already, please subscribe to the channel for more practical health advice tailored for our age group. Most importantly, if you know someone, a friend, a family member, a neighbor who complains about dry mouth, please share this video with them. This information could truly make a significant difference in their comfort and health, and sharing is an act of care. Thank you so much for watching and for taking charge of your health. Wishing you comfort, health, and happiness. See you in the next video.